Hey Jordan, I really enjoyed your post. I think it's interesting to see the difference in the amount of opioid overdoses that you see in your city or state alone versus the ones I see in my state. I'm from Kentucky, and there was just 117 related overdose deaths alone in my region that I live in. And I've been hearing about the opioid crisis for years. I mean, I know people that I even graduated with high school that have overdosed. I'm talking like 2 or 3 just in a month's period last year alone. I find it absolutely devastating, and it is shocking to see the numbers and how, they are very, very high in my region alone. It is upsetting to see that it is so much higher up here compared to where you live in Florida. I did like how you brought up physical therapy. I think that's great. I chose massage therapy for mine, so kind of similar, not really, but some of the techniques they use. I work at a psychiatric facility, so we really don't consult physical therapy that often, but I do see a lot of patients that are struggling with, opioid addiction say that, their main pain is in their back, their lower back, and I do feel like a lot of them could benefit from a physical therapy consult, maybe to do some stretching or have a physical therapist come in and teach them ways that could minimize lower back pain that I necessarily don't have time to do. I think that that's something that I may suggest to our doctor on my unit that I would do work for, the psychiatrist, that maybe, the patients that I do see that are, asking for help with their addictions alongside of their mental illness, that maybe we can consult physical therapy for them and get them help without having to use, a substance abuse treatment center, or they could use it alongside of that, or while they're on our facility. We don't administer pain meds. We do help with withdrawal, but we don't use Suboxone or anything like that. We totally just do the physical side of it, the physical symptoms. I think that is very interesting. I never really had thought about that working there because, like I said, we don't really use too many things to help with addiction. We set them up with, outpatient help. But I really, really, really enjoyed your post, and it is interesting to see a different side of things from Florida to Kentucky alone. I guess that's all. Bye.